Joint Bar, Victoria Schwazel, Prios Bus Stop 22, next to the Moshi Bus Stop, opposite the Grosile Bus Stop. Prios Bar and Grill in Corinth, Grosile.
Enhance, the best a man can get.
Hello, all realists. Thank you for listening to Real FM. If you'd like to call our studio, here is the number. Call the direct line on 4533911, or you can WhatsApp call on 4879849. Call to participate, win prizes, request music, and interact with our announcers and DJs. Real FM, the People's Station. The People's Station.
It is well known that diseases like diabetes, high blood pressure, and other illnesses may restrict blood flow, which can lead to impotence and erectile dysfunction. This is why Enhance was formulated to meet these challenging health problems, which can reduce your ability to perform. If you're having problems maintaining your manhood, then reclaim your manhood today with Enhance. Enhance increases your energy level, boosts your stamina, and increases your endurance.
You can get your Enhance at Southwell VA4, Restorer Pharmacy Soufre, Knights Med Miku, Lay by Bar The Morn, Dexter's Place Jeremy Street Castries, Citygate Bar The City opposite the market, Plants Place Denry Highway, Arlette Supermarket Soufre, The Release Stress Bar Labrie Highway, Cool Joint Bar Victoria Schwazel, Prios Bus Stop 22, next to the Moshi Bus Stop, opposite the Grosile Bus Stop. Prios Bar and Grill in Corinth, Grosile.
Enhance, the best a man can get.
Of Public Health Insider. My name is Jade Brown, and I am the Communications Specialist with the Universal Health Coverage Unit, as well as the St. Jude Hospital. Today, we're going to be discussing a bit of both of the projects, starting with, of course, Universal Health Coverage. As you know, UHC just started off a new service that would be mammography screening, which would be breast screening as well as mammography screening with a 3D machine, which was donated from the government of St. Lucia, one to the St. Jude Hospital and one to the OKEU Hospital. With the 3D mammogram machines, women, of course, would not endure that pain or discomfort that they normally would with the 2D machines. And we encouraged many women during the month of breast cancer awareness, which was October, which just ended, to take advantage of the service. Of course, the service comes at no cost under Universal Health Coverage, and with that, you saw that many women would have the opportunity to get this test, which they otherwise may not have been able to afford, many women, for absolutely no cost. And this is what Universal Health Coverage is all about. When we talk about UHC in this context, we're speaking about the essential basket of health services. So when you think of Universal Health Coverage, we want you to think of it in a 3-tier approach. These 3 tiers include the bottom tier, which would give access to medical services at no cost to all St. Lucians. The second tier is where you have an affordable health insurance plan for all St. Lucians. And those who cannot afford will still get the government assistance for their healthcare. And then the third tier would be for catastrophic events. Catastrophic events would mean where you would have to be flown out of St. Lucia to get emergency care and matters of that sort. So universal health coverage has a three-pronged approach. So right now we are concentrating on the essential basket of health services, where you have maternal and child health services, where women can access their laboratory tests, as well as their blood tests, as well as their ultrasounds at no cost. Then we have cervical cancer screening, which will give you your pap smear as well as HPV testing, and you can test for up to 16 strains of HPV, that's the human papilloma virus. You can test for up to 16 strains of that, which could not have previously been done, but because of the new methodology, which is the liquid-based cytology, women can now access that care. And what it does is give you a better view on your health and on the health of your cervix. It can also, you can also diagnose conditions and STIs and STDs at a quicker rate. We also introduce snake bite management, and with snake bite management, you all know that the anti-venom comes at no cost, your hospital stay comes at no cost, your follow-up treatment comes at no cost. Anything to do with snake bite treatment would come at no cost, and that's part of the essential basket of health services. I keep going back to the basket because this, like I said, is just one level of UHC. So just think of it this way. You have the first level of UHC where everything is free. Everything is free, anybody can access and whatnot. This is where we are at right now. And then we also introduced or relaunched the men's health clinic. And with the men's health clinic, we encourage men to get their PSA level checks for prostate cancer screening. And what that does is it gets rid of the digital exam, and we replace that with a blood test, so men would feel more comfortable to check on their health and take that opportunity to ensure that all is well with the prostate. And of course, as I previously mentioned, we recently launched the mammography services. So all is well with universal health coverage. And what UHC does is it gives people an opportunity to access care. No matter their financial status, no matter, thank you, Dravid, no matter their financial status, no matter who they are, where they come from. It will give them an opportunity to get the care that they need. So it's just that the camera is a bit distracting, sorry. So moving forward, we now need to speak about St. Jude Hospital. I know that a lot of St. Jude Hospital is the subject of a lot of discourse and a lot of contention as it pertains to the southern belt of the island. And in fact, everybody from St. Lucia, it's like that. And we understand it's been 16 years. It has been 16 long years since we experienced the fire at the St. Jude Hospital, and 3 people lost their lives. The hospital had to be moved to the stadium nearby, and since then that is where it has remained. Successive governments have failed to deliver St. Jude to the people of St. Lucia. We also understand that there are over 70,000 people who access care at the St. Jude Hospital. So we know that it is a very, very sensitive topic. We understand the sensitivity around it. We understand the people who deserve better care. We understand the plight of the nurses and the doctors. We also understand the plight of the technocrats who are working tirelessly in the background to ensure that St. Jude is delivered. We know. However, what we need to say is that we are closer than ever. And I know you've heard that line before, but it is simply the truth. We are closer than ever to the opening of the St. Jude Hospital, fully operational hospital. However, with that, it comes in phases. And I just want to debunk a couple of things before we continue. The first of which would be accreditation. Accreditation comes when a hospital, first of all, you must apply for accreditation. Then the body that you apply to would come to the country and to the hospital, and then they would carry out their processes, and thus you would receive accreditation eventually. Accreditation can take up to 2 years. It can take up to 2 years. And I also want to see that there are many countries in the world without accredited hospitals. I'm just pulling it up. All right. So we can look at the ones with accredited and we can look at the ones without. In the Caribbean, there are many hospitals, many well-known hospitals that are not accredited. And to be honest, it is something that is common. It is very common. It does not mean that the hospital cannot function. But when it comes to the St. Jude Hospital, we know that we are working with Accreditation Canada. It's an easy Google search. I assure you that you can go onto Google and you can research anything that I say to you here today. Accreditation Canada has agreed to work with the government of St. Lucia and with the St. Jude Hospital. They have already been to the St. Jude site. However, accreditation starts when operations begin. Accreditation starts when operations begin. So when the hospital is fully functional, then the accreditation body will come into St. Jude and the process will officially commence. But the initial dialogue has occurred. The initial work has been done. When the hospital is opened, then you would see Accreditation Canada come in. And of course, we will inform the public as we do. This has been a transparent process. From the 1st of November 2022 to now, it has been a transparent process. There has not been one thing that the government of St. Lucia has kept from the people of St. Lucia as it pertains to St. Jude. And then when we talk about commissioning, let's talk about commissioning. The hospital is in the process of being commissioned. The chair of the commissioning body is Mr. Williams, Mr. Michael Williams. I also sit on that body. We have doctors, we have nurses, we have the project officer, we also have the CEO of the hospital, we have the medical director, we have the commissioning director. There are many individuals who sit on this body. People who have, we have Sister Adesanya who has who commissioned the OKEU hospital. So from the Victoria Hospital to OKEU, she was integral in the commissioning process. She is also on our team. What we want to ensure you, the public, when you hear, oh, the hospital has not been commissioned, people will say things and they will not understand the meaning behind it. Commission means to begin operations, or the process of beginning operations, and that is currently being done as I speak. A team from St. Jude Hospital, the staff of St. Jude Hospital are in the dialysis unit with Mr. Silas Wilson, and they are conducting their on-site visit to see where they will be situated, where the equipment will be situated and whatnot, and all of this is part of the commissioning process. So yes, commissioning has commenced, and yes, it is continuing until we of course open up the hospital. Now, in order to open the hospital, we need to do so in phases. You cannot take a fully functioning, this is not a new hospital that we are establishing. This is a fully functioning hospital that we now want to relocate. People will not stop being ill. People will not stop seeking urgent medical intervention. The people in the IC unit, will not miraculously get better in order for us to pick them up from the stadium and put them at the new site. It is an active environment, and in this active environment, we need to ensure that the safety of the patients are paramount, is at the front of our minds. So we need to ensure that we keep them safe. We need to ensure that we keep the staff safe as well as we transition them to the new site. Therefore, we must start with, I would say, the low-hanging fruit. We start with departments like laundry and maintenance and the kitchen and outpatient units like dialysis and physiotherapy. You start with these departments because while they are big departments, it's easy to transfer. So this is the phased approach of the opening of St. Jude Hospital. Here are some other things that you can know. The commissioning of the St. Jude Hospital is ongoing, which I just said. These departments that I speak of for the first phase of the transition, they will be transitioned this month. This month, November, you will see functioning departments at the St. Jude Hospital new site, the OG site. The laundry, kitchen, administrative, and other departments have been furnished. These areas have been furnished. You've seen this on our pages. You've seen this on the contractors page as well. We've given you that information. The security office has been equipped. We have a fully equipped security office with screens all over the place. We have almost 100 CCTV cameras as well, all over the St. Jude site. The medical equipment is due to arrive this month. Medical equipment had to be shipped into St. Lucia, and with that, we are not in charge of the timelines. So it's a fluid environment, as I mentioned earlier. And we do have the CEO of the hospital who will be joining us shortly. So once she does, she can give more insights in the last 10 minutes of the show about the medical equipment that we are due to receive. All of the buildings are complete. So when it comes to the structure, all of the buildings are complete. I believe that we have Miss Lydia Atkins, the Chief Executive Officer of St. Jude Hospital. Good morning, Miss Atkins.
Hi, good morning, Jade.
Good morning, and thank you for joining Public Health Insider. CEO, today we're just going over the commissioning process and just informing people about where we stand as a team as we transition over to the hospital. So could you inform the public from your perspective what is happening at St. Jude? What's new with St. Jude?
At this point in time, Jade, we have been working, we have established a commissioning team at St. Jude Hospital who has had the responsibility to lead on the process reviews and process re-engineering for St. Jude Hospital, understanding that we are an institution preparing to move our operations from the George Odlum Stadium to our original home in OG. And as a result, we took this as an opportunity, one, to address the standards and look at the standards of operations at the hospital, as well as re-engineering our current processes to ensure that they are properly mapped for the new space that we are looking forward to moving into in a very short while. As part of that, we've also been undertaking an intensive review of the existing equipment that we have at St. Jude Hospital at OG, at at the stadium. As you can see, the excitement of the move is coming through in my discussions with you this morning.
Yes.
But we've been looking at our extensive review of our existing equipment. It's just to make a determination as part of the decommissioning of the George Ortland Stadium operations in terms of what it is that we are able to move across and take over with us to OG. Okay. We've also started the occupancy planning, and so we've done quite a bit of orientation with the team members across all of the departments of the hospital, so that they can now become very familiar with the space that they would now be expected to operate in. Understanding that hospital operations are very sensitive, and it's not something that we can just go in one day and having not had any sight of the space and an understanding of what is and where things are for us to be able to just walk in with operations. So we've had to do that orientation with the team, which is something that is still ongoing. We are also looking at some of the spaces, because you would have mentioned 4 main buildings that would be ready, and looking at how we can take a phased approach for the commissioning of some services in that space, using what would be a phased approach for the commissioning of the OG site, allowing us to come into spaces that are ready, come into spaces that are lower risk in terms of the testing of our protocols. And so there is quite a bit of excitement as we build towards that approach and the eventual occupancy of the OG site by the St. Jude Hospital team.
Okay, so for individuals who may be confused about the word commissioning and they are asking questions, in terms of the commissioning process, why is it important to have a phased approach?
It is important. You need to do quite a bit of testing, installation of the equipment. Once the equipment is installed, you need to do testing, you need to do training on the use of the equipment, understanding that you're moving operations from one facility into another, you're introducing new processes, you're introducing new equipment, and even when you're using the same equipment in terms of you are using an X-ray machine, brand different, supplier different. There's quite a bit of change that has happened in the market in terms of improvement of equipment. For example, we're introducing CT, which is not currently done at St. Jude Hospital. So there is going to be a need for intensive training of the team on the use of the specific equipment when it comes in. You can't wait until the entire facility is ready and all of the training has been done and you're comfortable with the full operations and then move. Or you can take an approach, given the fact that we have been operating at the stadium for the last 16 years. You can take an approach where it is that you will move into those spaces as you have conducted training and become familiar with it, and take a phased approach to a move, ensuring that your processes have been tested, known to work, that you have also been trained on the equipment, and that it is safe for the staff to be able to move into that space and to offer from the get-go the highest quality of care once we begin to interact with the patients. And so we have, for example, completed extensive training with the laundry team in terms of an orientation of the laundry equipment that has been installed in that space. And so we have done training with the team and looking at continuous training with that team, and with an anticipation that when we look at the move of services, that could be one of the first services that could be moved to the OG site, and which is also housed in one of those 4 buildings that would now become available to us for that phased approach.
Okay, thank you. Now, in terms of the gradual, can I say the gradual opening of departments, is there a plan to, what is the plan in terms of opening up operations in the various departments? Is that something that you can disclose right now?
It is not something that I would want to disclose at this point in time, but to give the public every assurance that we are working towards a safe opening of the hospital that allows us to provide care at the highest standard possible, and that we are excited about a move to a facility that meets the full requirements for hospital operations. We have looked at an extensive review of our clinical processes, which are currently being signed off on for final review by our clinical directors. We have started to implement some of the process re-engineering at the George Odlum Stadium to ensure that the team is now familiar with some of those new processes and ways of working, so that some of that becomes embedded even before the move to the OG site. But there is a detailed commissioning plan and occupancy plan for the OG site that will take a phased approach for us, for St. Jude Hospital.
Okay. So as it stands, I know I'm just being devil's advocate here. The buildings are complete, aren't they?
Yes, they are.
Excellent. Now, can you also dispel some of the rumors circulating around accreditation? I believe that there's a lot of confusion as it pertains to a hospital being accredited and then a hospital being able to operate. Can you dispel some of those rumors?
Yes, accreditation is a process. It is a process that can only happen after you have moved into a space and you are operating in the space, because they will be looking at, it is accreditation of your operations in a facility. A component of or some of the things that could affect or impact accreditation of your operations, because we have been assessed at the stadium by Accreditation Canada, and we have had some significant areas that have been identified as either diamond or gold at the George Odlum Stadium. Some of the constraints for George Odlum Stadium had been with regards to the space and how the space was built, and infrastructural things that affected processes. One of the things that St. Jude Hospital did in February of 2024 was to have invited the Accreditation Canada team to St. Lucia to have done a walkthrough of the OG site and to give recommendations on the workflow and the changes, that infrastructure changes that had to be made to ensure that once we started our accreditation journey, that it would not have been impacted by a building that was not fit for the proper workflows and processes to support accreditation or to allow for the facility to be accredited. That was done. That was done in some of our more critical areas, especially was done across the hospital, but I would want to highlight some of the more critical areas. So, for example, we would have done intensive reviews and recommendations were made, and those changes were made by the contractor to the surgical, to lab, for example, to allow us to start an accreditation journey once we've moved into the space and started operations, and to ensure that infrastructural issues were not a hindrance to accreditation. So it is not correct to say that the hospital was not built to a standard that would allow for it to be accredited. Neither is it correct to assume that the hospital could be accredited as is. It is a process. It is a process that we are intending to start once we have moved our operations to OG. There are very few accredited facilities in the Caribbean region. Barbados, Queen Elizabeth Hospital only having recently achieved accreditation. And the anticipation and the plan for us is that for St. Jude Hospital at the OG site to be one of the facilities and the only OECS hospital to be accredited if another one of our sister member states do not get there ahead of us. In terms of, I can't speak definitively in terms of where it is that Grenada is, for example, or Dominica is on the accreditation journey, but to definitely say that the plan is for us to become an accredited facility, and to say that because this was the vision for the hospital, that in 2024, we ensured that we would have had the engagement of Accreditation Canada and had them on the ground giving guidance on the infrastructural layout to support the proper workflows that would facilitate our accreditation journey.
Okay, excellent. Now, my final question as we end, let's end it on a high note. I know that you've worked so tirelessly, you have worked diligently as CEO of the hospital. I think you brought them through the very dark times. And how does it feel seeing some light on the horizon, CEO?
Jade, it is so unfortunate that I will not be able to share the joy of the individuals who did the first match from OG to George Odlum when they closed that off with their match from George Odlum to OG. My joy could never reach that level. So I have always told them that while it is that I will be at the forefront, leading and ushering, and it is such a tremendous privilege of my life and of my career to be in a position to do so, that I will be standing back a bit and watching with envy that only the employees of St. Jude Hospital who have worked at OG will feel when I look at the excitement that will be on their faces on their return home. And so it is a joy that all of us in St. Lucia will share, a joy that all of us in the South especially, and me as an individual from the South will share, to be back on the grounds that we've held so dear. I still remember my first bazaar as a child of the South and the excitement around that at St. Jude. But it will be to observe the true joy, will be to observe the joy, the satisfaction, the sense of homecoming that only the employees of the OG site will be able to feel.
Thank you, CEO. Thank you so much for joining us today. I know that you wanted to be here in person, but there's so much going on down at the site, as you've explained, that was impossible. But it's thank God for technology, and thank you for the clarification on all the matters that we discussed today. We will certainly re-air this episode so that those who have not listened will get a chance to learn from you, as you are on the ground and you're right there in the forefront of it. So thank you for joining PHI today.
Thank you again, Jade, for the invitation, and thank you, St. Lucia, for listening.
Okay, take care. Goodbye. So, ladies and gentlemen, there you have it. You've heard from the CEO, Miss Lydia Atkins, CEO of the St. Jude Hospital, as she prepares her team, readies her team, as they have already started the commissioning or transitioning process from the stadium to the new OG site. In the next few weeks, you'll see a lot of activity down at St. Jude P. Please look to our pages, the St. Jude Hospital and the Government of St. Lucia page, for more regular, insightful, transparent and truthful updates. This is PHI. See you again next week.